I think my medicine is making my acne worse. That's the question that we're going to talk about today. Welcome, I'm Dr. Arthur Kolsky, founder and medical director of Advanced Acne Institute, and we're a dermatology practice specializing only in the treatment of acne. So we have certain insights and experiences that we like to share with acne sufferers as they navigate the path toward clear skin. And this information is really just for educational purposes. It's not meant to be medical advice. So I'm in my office today and I want to bring to light some of the things that I'm seeing over the past week or two. And I've talked about this before, but I'm seeing it more often, more frequently, that patients are coming to see me and they have been using various things. They've been using topical medicines or pills and they say, "Doctor, I got this prescription, I went to get treated and I was given this and it's just making my acne worse. I think it's making my acne breakouts worse." And the reality is that we do see that. We are seeing that a lot in certain medicines more often than with others. So, for example, we'll see patients coming in and they're using various topical medications. Now, one of the problems with topical medications is that they can be very drying and very harsh on the skin. And one of the things that I like to say is that when you're treating acne, there's no need to be using things that are going to make your skin worse, that are going to irritate your skin and possibly make your breakouts worse. So there are other options. There are other ways of approaching acne. But that's a common theme because people feel, well, if I'm using something that's super strong and it's causing my skin to get irritated and dry, it must be working. It must be doing something good for my skin. But the reality is acne is an inflammatory condition by itself. So if you look in the microscope at acne, you'll see lots of inflammation in the skin. So the last thing you want to do is make that worse. So you want to be careful about using products that could be over the counter or they could be prescription, and they contain ingredients that are just really harsh and they make your skin feel dry and sensitive and red. So be careful about that. Now we're seeing a lot of patients coming with various retinoids. Retinoids are vitamin A derivatives, and they can be over-the-counter versions or they can be prescription versions. And these particular medicines can cause the skin to be very dry and very irritated and red. And so a lot of times that alone limits the usefulness because patients don't like that and they stop using it. But some patients continue using it. And one of the things that we've been seeing is that patients using this type of medication, they come and they say, well, I had acne only on my forehead and I went to see the doctor and they gave me this prescription cream and I started using it. But they said just use it everywhere. And so I started using it on the rest of my face too. And now I have breakouts on my cheeks and on my chin where I never used to have breakouts. So I think my medicine is causing that to happen. And they're right. Some medicines do have the ability to cause acne to get worse. And some people refer to that as the purge, but that's not really a technical term. But it's just the fact that those medicines are having effects in the skin, in the pore, and the pore is getting irritated and the pore is beginning to become abnormal in the way that it's functioning, and then breakouts occur. Inflammation sets in and breakouts occur. So we have to be very careful about that, and we don't want to get into the trap of getting a prescription that we think is going to work great, and then we find out that, hey, this is really making me worse because it's really causing my breakouts to get more inflamed, and I'm getting breakouts in new areas now. And so you have to be really careful about that. And you want to talk to your doctor about that. You want to ask, what's the chances that this medicine is going to make my skin feel more dry or irritated or get red or my acne get worse? And talk about that before you start using it so that you make sure that you have the best understanding of each medicine before you start applying it or a pill that you're taking, because that's important, because you want to go toward improvement, not go backwards. You don't want to take steps backwards. So some of these medicines do have the ability to do that, and you want to be very cautious when you make the decision to use a particular treatment.